So the Mental Health Act review published last week, the independent review of the Mental Health Act, modernising the Mental Health Act, and I'm really pleased that we're here today with Raf Hamaizia to talk about that report and to get your views on it
Thank you.
this time. So first of all, if you could just tell us a bit about your background and maybe how you got involved and some of your experience that led up to that.
Okay, so I was a service user for quite a while. Altogether, I probably spent around 5 years using a variety of different services, and I kind of came through secure services and stuff like that. I used to complain a lot when I was in hospital, and I kind of developed a relationship with a CQC inspector who suggested that I should become an expert by experience on discharge, and that's what I did. And so today I've probably taken part in over 100 inspections as an expert by experience. After that, I started working at Signet Healthcare as the expert by experience lead, and that's just to work alongside the executive management board to ensure that our service users have got a voice at every level of the organisation. Also, I was asked by Professor Sir Simon Wesley to chair the topic group on the independent review of the Mental Health Act for Asian and other ethnic minorities.
So tell us about that and how it went and what you as a group were looking at.
It felt very empowering because, of course, everyone was very empowering in terms of who we wanted on the group. So I had quite a lot of, say over that. And of course, just having myself as a chair who has got lived experience myself, I think is a big say. And it felt right from the start because it felt different to the last one. This one felt like it had more credibility. You had very experienced kind of patient leaders like, Steve Gilbert, who was the vice chair, and someone like Professor Sir Simon Wesley is quite open and honest. He kind of says it how it is, really.
Yeah.
And I think that's what we needed. A lot of the stuff that we're looking at was just about how to kind of improve the status quo with regards to what kind of provisions and access people have to things like advocacy, like culturally appropriate advocacy, which is quite a broad spectrum, and it can vary and it's quite subjective. But we're not saying, if a service that has majority of Asian people for there to be Asian advocacy as such, but necessarily someone who understands the community, understands the cultures and the norms. In my case, for instance, I come from a Muslim Arab background. In some parts of our community, mental health is looked at as more of a spiritual encounter as opposed to a religious one, and that has a variety of implications upon a service user, and did so myself, because your family and the community, the place where you're going back to, or this place which is the end goal of your recovery journey as such, doesn't quite understand what you're going through, and that's a problem. And at the most vulnerable part of people's lives, we want people who are able to advocate them, who understand those difficulties. And also, we looked at things like religion, and this was actually something that was based on my experiences, which is where I'm really touched by this review, is about the ability to practice religion without it being used as a restricted practice against you. And if you misbehave, you can't go to mosque on Friday or church on Sunday or something like that. And we felt that was something quite fundamentally wrong there.
And a lot of these things have made it into the report,
Absolutely.
And it's really clear to see that some of those experiences that people brought to the process are now there in the report in black and white. What did you think of the report when you saw it?
I mean, it was quite lengthy.
Yes, there's a lot of it.
To be honest with you, it was quite lengthy, but I think it was a fair representation. I don't feel things were too watered down, which is a surprise.
Yeah.
Because as you would appreciate, we go to these things quite often and we say all sorts, and then when you see it on paper, it's a little bit watered down. But I felt the report was asking the right questions. Some people have kind of said that it might not have asked for everything, and sure, we could have wanted more. But the important thing for me is that it's realistic. Because we could ask for the world, but we're not going to get it. A lot of the time. And some people say you should ask for it anyway, but I think if we're now talking about this move towards making real change, we need to start being realistic in our approaches, and I definitely feel that's a step in the right direction.
What would you like to see happen now?
Well, we'd like to see some implementation, and I know it might take some time. We're not saying that, I guess it will be an overnight thing, and I don't think anyone ever said that, but I think it would be good to actually have a kind of period of just kind of getting organisations together and say, look, this is what we kind of thought about, this is what's in the recommendations, and what do you guys think, how can we do this together? Because, you know, this idea of co-production, I guess, isn't necessarily just about the service user and a nurse working together to make a care plan, but about us coming together to have an impact on policy. As we develop and as kind of compassion as such almost develops or evolves, I think expectations do as well. You know, I remember a nurse telling me, for instance, that 20 years ago, other nurses used to laugh at him for involving service users into care plans, whereas today that's kind of expected in, you know, regulation, and it's just an expectation. So we've come a long way from those kind of experiences, but at the same time there's a long way to go. But for me, I think continuing on to practice your religion is one of the main things that I think will change. Because the reality is, I know a lot of services have got multi-faith rooms, but they tend to be just a multi-purpose room. Also, you know, if you're detained under the Mental Health Act, having a conversation about religion with your multidisciplinary team is a little bit scary. It can go wrong. You know, you could have your leave taken away from you because, you know, people start thinking you're becoming delusional again. Whereas actually religion, I think it's important for recovery. It's important for people's well-being, whether or not they have experienced or are experiencing mental distress. So, you know, we know that religion is important not only in recovery but also in people's identity. You know, when I say I'm Muslim, I'm not saying you know, a kind of, it's not a religious statement. You know, I'm not, you know, I go to Nando's whether or not it's halal, but my point is that it's an identity thing as well. It's part of my identity. It's who I am, and it's, I guess it's part of me, myself. I'm making an identity statement, and I guess identity is important for someone who's going through mental health difficulties, because at the end of the day there's so much stigma out there, and it's difficult to know who you are. What box do you fit in? Do you fit into this service user box? Do you fit into this kind of forensic patient box, or actually, you know, do you fit in the box of being from this community? As we support this idea that culturally appropriate advocacy and things like that, it'll create a better experience within that regard for people from those communities.
It'd be a really important marker that change has really happened if we see that and people experience it a lot better.
Absolutely.
Raf, thank you so much for first of all for being involved in the review, for making sure that there's that really strong voice, and for speaking to us today. Really appreciate it.
Thank you so much for having me. Thank you.